U.S. President Donald Trump Monday said anti-malarial drugs that are under investigation to treat the new coronavirus could be a gift despite scientists warning against the dangers of overhyping unproven medicines.
We think tomorrow pretty early the hydroxychloroquine and the Z-Pak, I think, is a combination, probably is looking very, very good, and it's going to be distributed. We have 10,000 units going, and it'll be distributed tomorrow. It'll be available, and is now. They already have it. They're going to distribute it tomorrow morning to a lot of people in New York City and New York. We're studying it very closely, watching it very closely. You probably saw a couple of articles today came out where a gentleman, they thought he was not going to make it. He said goodbye to his family. They had given him the drug just a little while before, but he thought it was over. His family thought he was going to die. And a number of hours later, he woke up, felt good. Then he woke up again, and he felt really good, and he's in good shape. And he's very happy for this particular drug that we got approved in record-setting time. There's never been anything even close to it.
Trump announced last week his administration was working to dramatically expand access to hydroxychloroquine and chloroquine, a related compound, following promising early studies in France and China that found the drugs help patients suffering from COVID-19. But many scientists, including Dr. Anthony Fauci, the U.S. leading infectious disease expert, have urged the public to remain cautious until larger clinical trials validate the smaller studies.
Dr. Fauci, as was explained yesterday, there has been some promise with hydroxychloroquine, this potential therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no, and the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that would give us information to determine if it's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
Now, that set the stage for an exchange with an NBC reporter rather. Take a look.
Nothing to lose. You know the expression?
You say the Americans were scared, though. I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism. And the same with NBC and Comcast. I don't call it Comcast. I call it Comcast. Let me just for whom you work. Let me just say something. That's really bad reporting, and you ought to get back to reporting instead of sensationalism. Let's see if it works. It might, and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens, John.
No, there really isn't that much of a difference in many respects with what we're saying. The president feels optimistic about something, his feeling about it. What I'm saying is that it might be effective. I'm not saying that it isn't. It might be effective. But as a scientist, as we're getting it out there, we need to do it in a way as while we are making it available for people who might want the hope that it might work, you're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
Is there any reason to believe it's not safe?
Well, certainly as a drug, any drug, John, has some toxicities. The decades of experience that we have with this drug indicate that the toxicities are rare and they are, in many respects, reversible. What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe. but I like to prove things first. So it really is a question of not a lot of difference. It's the hope that it will work versus proving that it will work. So I don't see big differences here.
I agree.